Welcome to Healthcare Innovation Trends from the Trenches. This is our second webinar in our series. I've brought together a number of experts in the field to tell you what they see happening in the trenches so that we can share our observations with you as they are occurring and share some of the challenges that we're facing in healthcare reform and innovation. Hi, I'm Andrea Simon. I'm a corporate anthropologist. I'm president of Simon Associates Management Consultants, and I've pulled together these experts into their healthcare series because we've been watching what's going on and we wanted to share it with you. Today, my guest and co-presenter is Diane Auger. Diane is a senior vice president of marketing at St. Vincent's Medical Center in Bridgeport, Connecticut. Diane is also president of the St. Vincent's Foundation. She's quite an expert on branding and rebranding institutions. I met Diane about 1.5 years ago. She was just starting at St. Vincent's, where I was conducting a board retreat on the topic of branding for changing times for the board of St. Vincent's Medical Center. We'd been working together ever since on both the external branding strategy for St. Vincent's Health Services and for the internal living the brand for what's going on inside the organization. It's particularly important as the hospital has been acquiring physician practices, opening up new physician offices and services in the community, and finding all sorts of different challenges to both what does the name mean in changing times and what does it mean to make an acquisition of a multi-specialty practice and begin to see doctors now carry the name of St. Vincent's forward. What does a brand really mean in changing times? So I share all of this with you because we've had 1.5 years of deep talk and time spent on the topic. What we wanted to do was to share with you the context of what's going on with name changing and branding throughout healthcare throughout the country. We started to conduct research to see what was taking place and how it was affecting the institutions themselves and the communities that used to count on them for certain kinds of services and might not be familiar with what the new name or a new identity meant when things were changing. So the agenda today is for us to share early insights of research that we have been conducting on the abundance of name changes and rebrandings. I think you'll be fascinated. I know I have been by how many hospitals and health systems are changing their names, not always with clear-cut strategies on what to do once the name is changed. I was particularly curious about why a name has built up lots of equity, and when we change it, we need to begin to take care of that equity and make sure it continues, or we need to change the story about what it represents. Diane then is going to share the power of the hospital's brand name and how to protect and reinvigorate it. And I use the word very intentionally because as we saw the challenge, it was how to reinvigorate a very strong name during changing times. What's so interesting is that the consumer research that we have done sets a different context for this. It's not just what the hospital is seeing looking outward, it's what consumers are seeing looking inward. Sometimes I wonder whether the factory is so internally focused on what to do and how to do it that often a healthcare institution or another type of organization forgets that there's a whole community of people out there that care deeply about what your name represents and what it means to them. They belong at that institution. And for St. Vincent's, we found that to be particularly strong and a particularly important issue for us to deal with. Then we'll return to the question about why brands matter. As an anthropologist, I'm endlessly fascinated by how people create communities and cultures, name things, we're very linguistic, and belong to places. Brands are not inconsequential, and neither are the names. Yet, with some of the name changing, I have to scratch my head and ask, what's happening? Why are you doing this? What's the power of the story, and why will the new one help you go someplace? What's your strategy? In changing times, the key questions we are all asking is, can we create and communicate a brand that is still or finally makes you and your organization the place to work and the place to go for healthcare? Or has it become so commoditized that people will go any place that's the right price with an assumed quality? Aren't all hospitals the same? Consumers asked us. Shouldn't all emergency rooms treat us similarly? And on the other side of it, you can inspire your associates and physicians to live that brand and become your brand ambassadors. Hospitals have 3,000 or 4,000 or 5,000 employees, sometimes 10,000. Shouldn't they be telling a brand story that's consistent, that helps communicate what you represent and where you're going as an institution? So we're very interested in the higher purpose. We've been reading about systems that are becoming population health focused. There's a higher purpose here. They're there to help transform the health of the people. I'm not sure what population health means to every institution, and certainly consumers aren't quite clear about it. But there's something very powerful here that's a much higher purpose than just taking care of you when you're broken. Keeping you healthy and keeping you living a healthy lifestyle is a different purpose, brand, and story to tell than simply we're here when you need us. The last point is, can we do it in innovative ways that add real value, not just change your logo or your color palette, but bring value to you in innovative ways that makes it simpler and easier for you to in fact get the health and wellness that you seek when you need it and how you care to pay for it. Now, the theme for all of our webinars is Trends from the Trenches. I thought I'd spend one moment on being an anthropologist in the field. We're well trained to do observational research and ethnographic study because we truly believe that people don't necessarily know what they do. They go about their habits every day, and they'll tell you stories that fit their perception of reality. But when you observe them and you sit back and participate and observe them, you learn all sorts of things about what's really going on. And so a great deal of our own research is a lot of observational research. So let me begin. At a recent Society for Healthcare Strategy and Market Development conference that both Diane and I attended, there was a thought leader session. And the entire session talked about the fuzzy future. And there was a lot of discussion. The keynote was all about will brands be valuable in the future for healthcare? And will they matter at all? Or will consumers just decide on price? They'll find the right price for the right x-ray or right lab work or right MRI and choose that. Or the most convenient, and I've heard this as well, it just is my local hospital and that's where I go. Or commoditized service, they're all basically the same. It doesn't matter whether I go to Walgreens or CVS or my local doctor. My biggest concern is with the paradox of choice. When people have too many choices, they don't make any. And I love this little sign, they feel lost, confused, unclear, perplexed, disoriented, bewildered, and in fact, that's what we're hearing. So it becomes very interesting in terms of what we're doing and what we're seeing out there. The trends from the trenches. We see widespread name changes that are happening without a focus on the brand. And name reinvigoration, those that are staying true to their names and building their brands and internally and externally using them to really differentiate themselves from the rest and create a story that, and the community that they serve means something, really is meaningful. Now, with so many hospitals changing their names, I went to look to see what they really meant. So in the research that we conducted, we found over 100 hospitals or healthcare systems that had changed their name this past year, and we're still digging. There's no way to find it. There's no directory. It was sort of interesting. There was no assemblage of information about it. This is a sample of the 100, and I just put them up here so you can see, and maybe you're as perplexed as I was. Durham Community Health Center is Legacy Health. LSU Medical Center is University Health. Jefferson Regional Medical Center is now Jefferson Hospital. Lakeview Hospital is now St. Luke's Hospital. Kennewick is Trios. I have no idea what these mean. But there's lots of new logos and signs and color palettes, and they're very proud of the new logo. I selected some of them to share with you so you can see some of the patterns that I was looking at. The Louisville, Kentucky-based Baptist Healthcare System dropped the system, changed its name to Baptist Health, and rebranded all 7 of its hospitals throughout the state. And the press release was very proud of the new logo. It's a very stunning logo. And all of these are now Baptist Health with a location. Columbus Regional Health actually discussed a lot of their consumer focus groups. They had a Houston name on several of their locations, and they had to create better clarity. That was interesting. This was a clarity of who we serve. Durham Community Health Center in Idaho changed its name to Legacy Health. Exactly how Legacy is going to communicate its openness to everyone in the community, I'm not sure. But they were sure that there was a common public perception that they only serve people who could not afford insurance, and that was not true. Kennewick is now Trios. and the name will better reflect its commitment to the Tri-Cities, they said, and its growing range of services. I do hope they invest a lot of branding and marketing storytelling about how that's going to happen. This was very interesting. Via Christi Hospital changed its 3 hospitals back to their original names. The health system only a few years ago had changed the names of the Wichita hospitals to match their street names in 2009, but decided the name should revert back to the original brand. The new name, the same mission, St. Joseph Health System, was now going to be St. Joseph Health. You can see a lot of health systems, health services are dropping the system or the services off, and it's reflecting its broader healthcare goals. This is an interesting positioning around population health. The spirit of the new networks of care focus not on just the hospitals, but the broader delivery of healthcare throughout our medical groups, outpatient services, and healthcare programs. And this was another one that was just locational again. Houston Methodist wants to differentiate itself from 80 other Methodist hospitals across the country. So if you're in Houston, you know it's Houston Methodist. So when I sorted them, it was an interesting split. Acquired, affiliated, and merged were 40 of the 100. Communicate, broader scope of care, was 17. They had a better Communicate affiliation and alignment with 14. Went back to the original name, 6, in uniform name, another 6, clarified people it serves. It's really interesting. To differentiate it from the competition, only 2. Now typically in branding, it's all about how are we differentiated from the competition. Clearly there's a clarification theme here. There's a brand hierarchy theme here. Differentiation and branding, not sure. My biggest concern is where's the strategy? Name change is often not driven by a strategic process, it doesn't seem. And rebranding isn't really the purpose here. It's not much more than a logo, a new color palette, and a celebration of having something new. There's nothing wrong with that. But these are changing times, and I don't want the hospitals to be like railroads. If you remember the railroads had a golden age for about 40 years until cars and airplanes took over. And I've been hearing this a lot in healthcare conferences. We don't want to be like the railroads. The railroads didn't realize that they were being transformed into the transportation business, and they didn't transform themselves quickly and strongly enough, so they're really not the dominant form of transportation here in the United States. Hospitals are facing the same kind of changing times. They are no longer in just the hospital business. Welcome to the care coordination business. Hence, a brand new name. One way an organization can emphasize this renewed focus is through a name change. It's true, but the more important question is what should that name mean and how do you make it come alive? You need to understand that names don't mean anything. If the role is changing, how does the new name represent it in some way? If you don't tell your story often, people will just make one up. Remember, if I don't know it, I'm not going to say I don't know what that really means. I'll say I'll make something up. That sounds like, trio sounds like something. The changes are generating fundamental questions about what they really represent. So the first thing that we really realized was the brands answer the question why you but new names aren't. They're supposed to differentiate you from the rest, but they don't seem to be. And it's supposed to make it easier for people to anticipate the care they will receive and help consumers make the right choices for them. And you need to understand that humans really want to belong. They don't want to just use, they want to feel like this is something that matters for them and they've chosen wisely. When we did our consumer research, people are worried. If they have the same name, will I get the same care everywhere? Like a Starbucks. Starbucks comes up all the time. Doesn't matter where you are in the country, if I go to a Starbucks, I get the same coffee, macchiato, whatever, served in the same way, with the same smile, in the same experience. Does that happen when you have the same name? What does a new name really mean? Really mean? Not just a new name, but what does it really come to represent? Maybe, and consumers said this to us, its name doesn't even matter anymore. It's just a hospital. That's interesting. Maybe it's a fad. Everyone's doing it, so maybe it's just a fad. And then they asked, isn't or shouldn't every hospital be the same? Doesn't matter where I go, should I get high quality care, evidence-based medicine, delivered by well-trained people who know what they're doing, regardless of where I go? On the other side, and at the Society for Healthcare Strategy and Market Development Conference, there were new options that were challenging old brands. Walgreens was there. and it was very interesting. On several panels, they were talking about how they were partnering with hospitals, but they're also competing with them. They're providing pharmacy prescriptions and drugs to the hospital patient at the bedside before they're discharged, and they're helping to walk them through the care continuum as they take care of themselves after discharge, hoping to reduce readmission. But on the other hand, they have wonderful little clinics, health centers, they call them, neighborhood health centers, in your neighborhood. And I love the little middle picture, yes, I am a real doctor room, because they're opening up inside their pharmacies access to care that's easy and simple for people to use. Walgreens has a very big name and a strong brand. The mini clinics, I knew the folks who set up the CVS mini clinics. CVS knew that every person who came into their clinic dropped $40 to $70, and they were a highly desirable customer. And we were working with one hospital that was talking to Walmart about putting a clinic in. For $65, you could go into Walmart anytime there was a PA, a doctor there, and get the care you needed for your UTI or your bronchitis. So you have, on the one hand, a lot of hospitals trying to figure out what their name and their brand means in changing times. Then you have all of the retailers coming in with options that are perfectly good solutions at some level of care. And then you have hospitals with a higher purpose. St. Vincent's is affiliating with MD Anderson's Cancer Network. And as we've been doing the research on it, I became struck by the fact that MD Anderson has a higher purpose. It isn't just the best care you can get when you need it, it's making cancer history. And it was real interesting. I was in Houston not too long ago, and the number of people in the airport who clearly had come there for cancer history purposes were quite astounding to me. But people who I met in Houston were all talking about how MD Anderson is making cancer history. A higher purpose, a little like IBM creating a smarter planet, not selling consulting services. So if we're doing population health, if we're forming a new system, creating a brand new name, maybe there's a new brand here as well that has a higher purpose. So I went looking to see who might be doing it that I could share with you. And while name changing is old and the robustness is new, and if you kept your name, you could do that as well, I wanted to see who might be creating a more higher purpose to the whole process here. So let me share with you one hospital. I met Stuart Schaefer down at Baycare several years ago, and I spent a little time in Tampa. And Baycare in 1996 had started to change its name and its brand and its positioning. These are some of its hospitals. When Stuart came in, he realized that Baycare had become a back office for the hospitals as opposed to a driver of the brand. It was a perfectly good house of brand architecture, but then he changed it, and the organization began to see a future that was very different, and it's all Baycare now. Baycare is the endorser for St. Anthony's Hospital, but the logo is a Baycare one, and it's Baycare Home Care. The future focus is very clear. The name change set a platform for acquisitions and integration. They've created a division of hospitals along with Baycare physician partners. They're not one with a sub, but they're partners here and equals. They're strategically focused on population health and wellness, almost a statement of a higher purpose. They're strategically focused in such a way that even on their online experience, they emphasize how they can help you throughout the entire Baycare. And with 11 hospitals and outpatient facilities and services, they are really providing expert medical care through a patient's lifetime, is what they're telling you. What Stuart said to me is what I can tell you is that healthcare systems should borrow a page from both the retail and the hospitality sectors. As medicine becomes more retail and outpatient focused, our own system evolution has changed the definition of quality from clinical to a focus on delivering better patient experience in all care settings. And this I loved. He said, aspects of hospitality, making sure patients are comfortable with a minimum of pain, a quiet hospital, patient advocacy, all hands approach. Baycare's brand is evolving to stand for a healthcare experience using retail and hospitality benchmarks. I should add that Stuart came from a non-healthcare background and has a very robust branding and marketing strategy. Now let me introduce you to my colleague, Diane Auger, and let her tell you about the benefits of strengthening your name and building your brand. I'll give you a little setup. Diane is really leading the process for her brand's resurgence. I will share with you that her board is very dominated by people who come out of places like Unilever, and other highly recognizable brands, and they understand branding and living the brand. So we didn't have to sell the board on this. They were right on board with how we had to really live the brand effort. For St. Vincent's, it's in part about the brand new, about the brand direction, about brand invigoration, not just the name, but what it really means. So when I started working here, welcome to St. Vincent's. When you walk through these doors, you just feel like this is where you belong, was all I heard. It wasn't a place where you got care, is where you belonged. So let me switch the earphones and put Diane on.
Thanks, Andy. Good afternoon, everybody. I just want to give you a little bit more background. As Andy said, our board was very much brand savvy, and I actually started at St. Vincent's in June of last year, and on my second day I was at the branding retreat that Andy led the board through, and could hear them searching for things like clarity and unity, vision and alignment about who St. Vincent's is and who it will be in the future. And we already knew a little bit about our brand in terms of research we had done that told us that once someone experienced St. Vincent's, they were really loyal fans. And so the question at the end of that retreat was, how do we move people who may not have an opinion towards St. Vincent's and move market share? So a little bit about St. Vincent's. We're located in Bridgeport, Connecticut, and we're a community teaching and referral hospital. And we've got several affiliate organizations, including a health sciences college. We have a special needs school, the foundation, and we're also a member of Ascension Health, which is the largest Catholic healthcare system in the United States, founded St. Vincent's in 1903. So the need to assess our brand, as we discussed, came up at that board retreat, and basically you're all aware of all these things. Healthcare is changing, and I'm a newbie to healthcare starting about 18 months ago. I came from outside of healthcare, so all new to me. In Connecticut, our landscape is really in flux, and it's very competitive. For all of us, demographics are changing, our population's getting older, our consumers are more sophisticated, so the choices that they're making are their own, not necessarily always their docs. There's a social media world out there that we need to determine who we are in that world. And we felt there was strength in our brand. We wanted to determine if we were right and whether we were going to be able to optimize the brand across our whole organization in terms of growth opportunities. And so what were we going to do about our position, and that would inform our brand strategy. We looked at these questions about building a comprehensive brand strategy. What do we do actually? And how do we deliver what we say we do? What's our personality? What are the values and cultures that we care about most as an organization? Internally, how do we treat one another? What are those shared values? What do we have in common with each other? And back to Andy's point about a higher purpose, what is our noble purpose? Why do we exist? We know what our mission is. Who are we? And is that scalable across our organization? And so we started really by looking at our master brand. So most of our work was centered around this master brand. It's the most identified and the largest part of our brand, and that's because we use that for our medical center. So we took a look at who we were, and currently, at that point anyways, we had lots of unique identities. We had a lot of affiliate organizations, service lines, independent department decision-making, lots of independence, a good thing and also sometimes a bad thing. We really weren't fully integrated at that point in terms of a system approach, and that was leading to, as you can imagine, lots of costs that we needed to pull out of our organization, as all of us have looked at ways to reduce our costs, and really look at our strategy and have that evolve into one that we could create an end state vision where we were all together. But that duplicate cost structure and all those personalities were leading to something that looked like this. And what you see is somewhat chaotic, and demonstrated for us that there was a lot of lack of alignment among all of our organizations. If someone looked at this from outside, they would want to know, who are all these independent organizations? Well, they were all part of St. Vincent's actually at that time. So the key questions that we started to determine for us were things like, what is the positioning for St. Vincent's overall? How will we leverage that perceived power of St. Vincent's to grow into new markets and innovative new services? And then, what do stakeholders really think about us? All those different stakeholders that all of us have. And what about those potential new affiliations? As Andy said, we were just becoming a certified member with MD Anderson. We've become the clinical partner of a new medical school in Connecticut. And so what about those potential affiliations and ones to come? So we embarked on research, actually with Andy and Simon Associates, and it was really important from the beginning to provide all of our healthcare leadership, which I learned very quickly, in particular doctors, with evidence for the conclusions that we were going to bring them to. So lots of research, internal, external, competitive reviews, research about the market, really looking at an articulation of what our position could and should be, what makes it valued, why are we different, why are we competitive, and what's relevant in our marketplace, and then coming up with a positioning to determine if it would be valued and understood. So what began as really, look at all these crazy logos, which was really just a catalyst. It really wasn't about logos. It was about collective agreement about how we were going to live our St. Vincent's brand. So we started internally, and we asked employees and physicians to tell us stories. What did they think about our brand? And what we found, as Andy said, most people said, when I walked in the doors of this place, I just felt like I belonged. And some of the stories they told us were things like, it feels like family to me. We are not just a team, we're a community. And we hear that word a lot here. And the fact that it's a spiritual organization, not just from a Catholic perspective, but the fact that you can feel and see a spirituality, and I'll go back to that higher purpose and that calling that the folks who work at St. Vincent's have. So then we said, well, let's see how we connect with our market. How do we connect with non-St. Vincent's patients? What do people think about us out there? What we heard from those consumers was that healthcare and hospitals in general are inherently stress-causing. So they want to know, how can you help me take the complexity out of my healthcare experience? I want to go somewhere that's simple. I want to go somewhere where I feel like people care about me, where the systems work well, where I really feel like they have the information that I need the way that I want it when I need it. And it was interesting to us as we watched some of these consumers. It didn't matter if it was an 82-year-old woman or a strapping 35-year-old man. They wanted to be in a place where someone cared about them. That came through very clearly. So then we said, well, how do St. Vincent's patients feel? Are they the same or are they different? Because we heard that once a St. Vincent's patient, always a St. Vincent's patient. What made them different? What we found was that the St. Vincent's patients were more focused on how it felt for them to get care. They felt like they belonged when they were at St. Vincent's. They knew that that nurse was care, that the care was all about them, that touch was about them. And of course the doctor was important. But that experience that they had, that their family had, was the most important to them. We also determined, as we knew from coming outside of healthcare, that everybody expects new, clean, and safe. Everybody expects the latest technology and the best doctors. They really want a place that's organized, but really the key theme was they wanted to feel an experience that was one of caring. So we decided, because of this evidence-based approach we wanted to take, that we would do a little more research, and we did some personality research about our brand, and we probed those elements of personalities that people perceived set St. Vincent's apart from our competition. And it was to determine whether or not we were a brand that people wanted to avoid versus being a brand that people wanted to approach. So the point of that all was that the personality characteristics of St. Vincent's really seemed to us to resonate with the consumer, with those non-St. Vincent's patients. We felt it was a differentiator that we could use to set the St. Vincent's experience apart from our competition. And it happens to be the one everyone's looking for. And the better news that we could tell our associates was we already behave that way. That the experiences that people want to approach, not avoid, are the ones that are already taking place. And that was really evidenced by those patient stories and by the associate stories that we heard. So this is just an example of the contrast in some of the personality research that we did. We found that St. Vincent's was perceived as compassionate, open, a big heart, sensitive. We found that our largest competitor was really one that seeks attention, is formal, distant, hurried, lacks a calming influence. So again, as we thought about what are people looking for, they're looking for the experience that St. Vincent's is already offering. We just needed to make sure we told more people about it. So we brought a promise to our associates and to our board after we did all this research. This is what we concluded. Our promise would be embedded in all of our marketing communications and our behaviors. And that promise was that we would be that system, that healthcare organization where there's a community of caregivers whose compassion makes us better at what we do, that we listen more carefully, we work together more efficiently, We use the tools of modern medicine more skillfully, and we bring our hearts and our minds to work. And we help patients and their families feel calmer and more confident in that very stressful time in their lives. And this was a promise we felt we could make across our entire organization. So we decided to launch this new theme with a service line campaign, and that service line is cardiac. And we focused not just on what, that's the sharper minds, but how, the gentler hands, that experience that we were providing at St. Vincent's. And we utilized our own docs, our own associates in this campaign. And you'll see on the left-hand side the gentler hands theme. Gentler hands make your diagnosis a calming experience. And then the complementary ad, sharper minds make the most complex heart procedures feel simple. So we launched all of this as part of a promise to our associates that we would share with them everything we were going to tell the public, right? We need to do this promise together. We want to have this fulfilled together. So we took this promise to the board, to our associates. We shared all the research with them, and we asked them the key question after that. How are we going to fulfill this promise together in every single thing that we do? How do we make it to each other, to our physicians, our patients and families, students and teachers, our friends, and our community at large? And the launch really mattered. We took lots of photos in advance. We made it a very personal opportunity for us to talk within our own organization about this promise that we're making about gentler hands and sharper minds. And we aligned on how we're going to live the brand. We agreed that we would create an exceptional patient and family experience that would really distinguish us from our competition. And we also agreed and promised together that we would be ambassadors for our brand, that we would keep this promise together. We would work at our organization with pride, and because we're the best people to refer people to our own organization, we would tell everybody about what a great place it is to work and to use as a healthcare organization. We included real stories when we talked about the brand to our associates. Why does this matter? We introduced them to a gentleman named Frank who told them about the story of coming to the infusion center, meeting everybody. Everybody knew his name. They took care of him like he was a member of the family. And the best news was, this was before we told them about living the brand. They were already doing this. We shared the story of Angel, a really special nurse who knew that a patient was having surgery the next day that would require her head, a portion of her head to be shaved. She happens to be a hairdresser as well. So she took one afternoon and she actually helped this patient by giving her a haircut in her hospital room, and the whole floor was there. And she was already doing that. So the best news was that experience was already happening at St. Vincent's, and now we could really share some stories about how to be even more intentional about that experience. Engagement about living the brand is key. So when we have this launch, we really made sure that everybody heard about it. We explained it very rationally in the beginning and then emotionally in terms of the gentler hands and sharper minds theme. We gave out t-shirts, we gave cups out. We really wanted to get everybody engaged in it. And we made that promise that we would continue to share how we were going to be promoting the brand inside first, so that when an associate sees a new ad campaign that comes out that says gentler hands, sharper minds, they're not surprised by somebody who says, hey, I saw your new ad. They can proudly say, I know, I was there. So in summary, our path to leading us through this in conjunction with Andy, the path to the positioning really is on the left. We really took a look at how we wanted to assess our brand. We did a lot of research. We communicated the purpose of that research. We did more research, as I said, because the docs really needed to understand how we landed on this position. And we wanted to use that to gain agreement. We knew we wanted to be consistent across our entire organization. And we wanted, as Andy pointed out, we wanted to tell our story before somebody else told it. And the way we're executing living the brand is we're being intentional about it. Everybody understands it across our organization because we're communicating it widely. We're launching it with fun. We're ensuring that HR's engaged in this because we're going to hire for brand fit from now on. And it's really not a program, it's behaviors. It's a set of behaviors that you train for, that you recognize, and you reward. And it's really been a great accomplishment to be able to provide our associates with a way that they can live the brand, and actually that they were already doing it. And that was probably the best news I think that we ended up with. And so so we're happy about where we landed, and thanks to Andy for giving me this opportunity to share it with you.
Diane, that was really, as I listened to you, I realized how far we've come, how much more there is to do. I spent a day last week going through orientation to begin to see how we begin to onboard people. And at every touch point, we need to be telling a story. So let's go back to the beginning question, name changing and the power of brands during healthcare's evolution. And these are changing times. There's nothing I enjoy more than times that are chaotic, but most people really get very upset. So I want you to remember the railroads. Remember healthcare the way it used to be, where there was a doctor-patient relationship, and now it's changing. And the branding is changing as well. The internet is changing how people decide things and the power of brands in that decision-making process. I found this one little chart. This was actually from 2008. And I hope it's not too hard to see, but the new second opinion, on the left it says 88%, I usually turn to my physician to validate info I get online. And on the right, it says 88%, I usually turn to other sources to validate info I get from my doctor. And Diane would tell you the story of her mother, who went online, an elderly woman, went online, diagnosed herself with shingles, and went to her doctor to tell him what she had. Well, we say that the older person isn't necessarily an online shopper. She's an online shopper, and she's a cool lady. So there's a whole lot of new second opinions happening. Maybe then it's more than a name that we need to worry about. Healthcare systems might consider their brands as a vehicle to build relationships with consumers, again, and in different ways, particularly if we're going to worry about that higher purpose of the health of the population or the community. Brands are a beacon to unify a system across multiple touch points and points of care. I don't think you should dilute that or ignore it. If you really have power in your name, when they see your name, it means something to them. Could you be the Starbucks of healthcare? Even if you have 11 hospitals, should they all not be delivering the same quality of care in a similar, if not identical way? So the expectations are, if my name is on the door, the care is mine. The paradox of choice is real. The more I think, the more confused I get, says that little child. But in fact, the consumer said to me they have rising deductibles, so now they have to pay attention to what it costs. Tremendous amount of confusion and cynicism over the changes. They don't know who to trust. Isn't my time worth as much as the doctor's if I have to wait 3 hours anymore? Or if I go to an urgent center and they give me 2 aspirin and tell me to go see my doctor, 2 Tylenol. Usually, I'm really frustrated. Habits. People are very habit-driven, and they are attached to what they know and have always done, even if it may not be any longer the right thing. But you can't discard that, because then they really feel lost. So our job in healthcare institutions, and those of us who help healthcare institutions, how do we simplify the decision process? Simple sells. How do we inspire people to feel that you are the right solution for their new personal needs? How can you be their compass? What are the images that can come out of the new naming that can help tell a story so consumers see you as really a highly valued friend? The naming decisions, at least if you want to understand the mind map, is how do we focus it on the future? I thought Baycare had articulated a very cool way of thinking about it. The name should set forth a map with a brand story for who you are and where you're going, and then everyone has to be aligned to the strategy. This is a strategic issue, not a naming one. The mind creates a map and it sorts reality to affirm what it knows. So this becomes a mind map for your users. What stories should employees tell? How do you create a simple story? We grow storytellers was just a cute way of articulating it. But part of this is what story should be told? What does a name mean to them? They are your brand ambassadors. Who are they telling about this wonderful place they work? Are your leaders. Don't underestimate the importance of your senior leadership as brand builders, driving change and inspiring employees, physicians, and patients. If they are not, the rest will look upon it as simply sizzle without a steak. Word of mouth still wins, but now it's a very different word of mouth. The number of people on patients like me should not be underestimated. If you look at any of the forums, MD Anderson's forum, for example, people are asking, if I come to MD Anderson, what is the experience like? Am I the right patient for them? Will they treat me well? You have to convince consumers to convince other consumers to believe in your brand and talk about it as the right solution. Here, there's something called TrumbleMoms.com. They're all talking about doctors they like and doctors they don't. If you don't think that's a powerful influence on which mom takes their kid to which doctor, they'll count on each other rather than talking to any sophisticated nurse or doctor. You should want a lot of good conversations happening. And they can't happen unless you help feed them and keep them going. At the end of the day, it's all about experiences. Humans are very experiential. I can tell them something, but if they experience it, they get it. So you have to go beyond the expected and create experiences that separate you from the rest. Starbucks is just a different cup of coffee than Dunkin' Donuts, and it's both coffee, but boy, they are different. You must be true to whatever you're promising, and you must bring the brand to life in a way that's ownable. Only at St. Vincent's will you get the care and the compassion you need by a team of competent and exceptional doctors, nurses, and staff. Are you going to be the best of the rest or the only? So remember, we're humans. I always like to remind people that brands matter to us because, and I know it sounds like maybe not, we're birds of a feather and we flock together. We live in communities with others who are like us. We buy with emotion and we justify it with reason, so it's got to feel right. And we're herd animals. That culture should not be underestimated, and you'll find that people, when they are in confused times, that paradox of choice becomes very unsettling. Names aren't names, they're symbols. It may be a name and a logo to you, but it's much more about what each represents. We're very symbolic creatures. It's part of the human essence of who we are. Language and symbols matter. If you don't tell the story, they will make one up because nobody likes to be without a story. Intangible experiences have real deep meaning. So you cannot just change your name. They want to believe in your brand. They want to belong to your flock. They ask, can you help me, connect with me, engage with me? So my final thoughts, and then we'll open it up to your questions. If you're going to thrive in these changing times, remember that changing names do not create new brands. If you didn't have one to begin with, you might as well change your name, it doesn't matter. But what really matters is, who are you? And why should I choose you? If you change your name, it may dilute the brand you have. So you must protect it very carefully and tell it very, very carefully inside as well as outside. New names need new stories. If it's the same old story with a new name, why bother changing your name? The staff need to embrace and live the new brand. They need to understand what's new about the brand new. They need to tell the story with authenticity. And new healthcare is not a place or a thing, but an experience. So if we're going to really manage the population's health, we better experientially figure out what that actually means. So I always like to play out the Jerry Garcia line, who do you want to be? They're not the best at what they do. They're the only ones who do what they do. And in these challenging times, you can be the old hospital, you can have a new name, or you can be the best of the rest or the only. And this is a time for us to think through carefully what we're doing with our name, our brand, and how we live it. It isn't inconsequential, and I think to thrive in these changing times, people are looking for us to lead and to help them make the right decisions. So, with that, I'd like to pause, and I think there are questions that have come through, but I also had several questions that came to us from my email in advance. And I'd like to share them with you and then see if there are other questions that arise. Let's see, I'm just pulling up the questions here. The first question that we got is, can you suggest strategies that will help us grow our brand share? And I thought I would answer that. And then there were several questions to Diane about the specific things they are doing to get the employees to live the brand. But brand is really quite interesting since it's so experiential. The question becomes, how do you get people to experience you when they don't need you so they know what to expect when they do? One of the clinical leaders here held a men's day recently, and they had 70 men attend a session all about men's health, a bit about prostate cancer. 70 men came in, none of whom had been here before, all of whom now had a different experience. In healthcare clients that we have, we often use experiences as ways of introducing what we represent, the values that we have, ahead of time. We used to actually have a seniors night at one hospital, and once a month we invited all the senior centers and we bussed them in so they could come into the hospital and get comfortable with it, so that if they ever had to come, they didn't feel like they were alone. So the question really becomes, how do we engage the community in ways that make them feel like they are part of our flock before they have a healthcare need that they would require? The second one is, do we have to have all of the named hospitals or physicians' offices having similar experience, and how do you do that? Well, I guess this is a point of view I have, which is if my name's on the door, I better have the same experience or something pretty close to it. St. Vincent's has had 4 years of A rating leapfrog in safety. As we acquire physicians who are now part of the system, shouldn't they also be highly safe and high quality doctors actually following very similar practices? So I do think you have to give some thought to whether or not you'll allow that cardiology group to do it that way and that other cardiology do it to another. As I talk to my colleagues, they're all struggling with a system that's been named and everyone's doing it differently. Hospitals, 11 hospitals, all of whom have their own way of admitting you, treating you, and discharging you. Why have the same name? And Diane, I'm going to give her back the earplugs here and let her talk to you about the things that she's doing to get employees to live the brand.
Well, besides sharing the research and really explaining how we got to where we wanted, and through that launch that I talked about, we're really allowing each other to hold each other accountable to living the brand, and we call it Be St. Vincent's. When we talk about our awards, we use Best St. Vincent's, and if you split that up, it's Be St. Vincent's. We're a highly reliable organization, and so we all are required to really live a high reliability, and so we want to also be highly reliable in terms of the experience that our families and patients are going to receive. Again, no matter what point of service they get it through an urgent care center or physician practice, and so holding each other accountable and saying, hey, I'm not so sure you were being St. Vincent's when you spoke to that particular person or that patient. This is how I would suggest you do that. And then just, those simple things, like we had an employee who said, I love the polo shirts you gave us last year with our name. Could you please give us some t-shirts so I can go to the gym and be proud about where I work? And so that was terrific. It came from inside, and that's why I mentioned that we gave everybody t-shirts. So simple ways that you allow employees to be proud about where they work just in their everyday life. And again, that other point about making sure that they know that there's a promise out there and they feel proud to help you live it.
This one was an interesting question. Remember, I had emailed about 25 of the folks who had registered early and asked them for their questions. So this one I thought was very good. It has always been especially hard for hospitals and other healthcare systems to take branding and marketing that seriously, when their larger mission is to save lives and help cure the sick. So Diane and I both giggled a little bit about this. Does marketing end up taking a back seat at hospitals more often than it should? Or is that changing now that hospitals need to become better businesses attracting new patients to survive? So I'll share with you one thought, and then I'll give it back to Diane to share the other. Because at one point in my life, I was the executive running branding for 2 different healthcare systems. And those senior leaders who understood the whole process of branding and marketing invested in the branding and marketing. In some ways, I tell people that it is all about branding and marketing. But Stuart Schaefer down at Baycare has 35 people in his marketing area, and he has a marvelous online experience. He does a lot of screenings and other types of things, and his entire marketing thrust is to build a brand that people flock to, and they feel that that's where they belong. So I do think that it's changing. In some ways, though, you need to understand the ROI. You need systems in place so you can do targeted direct marketing and see the results. You need to be able to have events where those people who come become potential patients, and you need to be able to track them through the whole process. So you need a pretty sophisticated marketing, branding process, and an understanding of what that means. And there are some wonderful agencies out there that are doing great work, that are adding tremendous value to their clients, and it's much more of a partnership than a vendor relationship. Here, hold on, let me give Diane a moment.
Well, I think I would add to that marketing's got to be part of your business strategy, and I think maybe in the past it's just been all about advertising and advertising against the competition as opposed to taking a position in the marketplace and finding out if it's defensible, and I believe that's what we've done. I would agree that we've got to find ways to make sure that marketing looks at ROI, especially in the leaner times that we're involved in. We've got limited resources. How are we driving the business and as part of the business strategy? And partnering with organizations, I think, like Simon Associates and also Franklin Street, which is the company that assisted us in terms of the marketing side for our campaigns, and that strategy was really important for us to take a look at who are the best people to help us on this kind of new journey that marketing healthcare is going through.
I'm going to open up the question section just to see if I have additional ones. Let's see what I have here. Can a hospital use their food service department to create enhancements to their brand? It's not hospital food any longer. You'll be both patient food and guest food at retail locations.
Well, that's an interesting question. We're going through that right now because we're taking a look at our cafeteria. We're taking a look at how we can make it more user-friendly and perhaps take a lesson from some of the hospitals that I've heard about that actually are encouraging people from the community to come in and have dinner on particular nights, draw people in for seminars, and really use the hospital cafeteria as a gathering spot for the community. So I think that's an interesting question. There may be some best practices that we can find and share with others.
So one of the questions here, how often should a hospital or health system brand reinvigorate itself? How often is too often? You have a thought?
Well, I think for us, and perhaps for people that are out there, it's take a look at who you are today. Is it the essence of who you are already? And if it's resonating with consumers, it's a strong brand. And so we'll use our example for St. Vincent's. We thought we were being perceived as a strong brand. We thought we had an identity out there that was going to attract people. We heard from people who became patients that they would never go anywhere else. So there wasn't a need for us to become something else. We needed to really determine if we could gain some traction on who we already were. So I think assessing who you are and talking to lots and lots of stakeholders about what that means. Now and in the future, I think that's another point that people have to really take a look at is who are we going to be? What is our vision for the future, and are we right now structured appropriately and talking about ourselves appropriately in the new world of healthcare, wherever that's taking us?
There's one question here, and they can't hear me. So many hospital names have religious affiliations from long ago. Is that a plus or a minus? You want to say the question again?
Yeah, so many hospitals have religious names from affiliations long ago. Is that a plus or a minus? That's an interesting question. We're not changing our name. We're part of a very large Catholic healthcare system, so I'll speak about it from that perspective. I think there's an expectation that a hospital that began as a Catholic hospital or perhaps has a spiritual name has that kind of higher calling, and that the experience will be one of spirituality and compassion and care. And so I think for us it was an important piece of our personality. It's an important piece of our foundation. It's why we exist. And whether or not that becomes something that someone wants to take out of their name, I think that would be an interesting question, and I'd have to understand what probably the complications might be about doing that.
I think we've just about come to the end of our conversation. Both Diane and I are delighted to continue any questions afterwards. Let me give some thanks, if I can move this down 1 second, to our sponsor, Healthcare Innovation by Design. If you're not a member of the Healthcare Innovation by Design, there are about 6,800 members across the world. Executives, entrepreneurs, clinicians, designers, architects, engineers, and IT professionals. Sam Basta is an innovation expert and a physician, and down in Centara, the leading innovation hospital system. It's just a wonderful group of people, and I truly appreciate their endorsement and their support. Our next webinar will be January 17th at noon. Linda McCracken is Vice President at Truven Health Analytics, and she's an adjunct lecturer at Harvard School of Public Health. We've been talking a lot about data. How can the data help us do better? How can it help us see which ways to go as we innovate in new fashion for changing times? and she's got a wonderful webinar set for that date. For more conversation and information about Diane or myself, our information is on here. This will also be loaded onto SlideShare with the audio so that you'll have an opportunity to share it as well. We truly appreciate the time.